Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client who is newly diagnosed with paranoid schizophrenia tells a nurse, "The aliens are telling me that I'm defective and need to be eliminated." Which of the following responses by the nurse is most appropriate initially? 1. I know those voices are real to you, but I don't hear them. 2. You are having hallucinations as a result of your illness. 3. I want you to agree to tell staff when you hear these voices. 4. Your medications will help control these voices you are hearing. The correct answer is 3. The client may act on command hallucinations and harm himself or others. Therefore, the staff need to know when the client is hearing such commands to ensure safety first. Telling the client that the voices are real, but that the nurse doesn't hear them would be an appropriate response later in the client's hospitalization, when the client's safety is no longer an issue because antipsychotics are beginning to take effect. Telling the client that the hallucinations are part of the illness or that medications will help control the voices would be appropriate once the client has developed some insight into the symptoms of the illness. The client with tuberculosis is to be discharged home with community health nursing follow-up of the following nursing interventions, which should have the highest priority. 1. Offering the client emotional support. 2. Teaching the client about the disease and its treatment. 3. Coordinating various agency services. 4. Assessing the client's environment for sanitation. The correct answer is 2. Ensuring that the client is well educated about tuberculosis is the highest priority. Education of the client and family is essential to help the client understand the need for completing the prescribed drug therapy to cure the disease. Offering the client emotional support, coordinating various agency services, and assessing the environment may be part of the care for the client with tuberculosis. However, these interventions are of less importance than education about the disease process and its treatment. A premigravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. A client is sitting in the corner of the day room cocking his head to one side as if he hears something, but no one is nearby. The nurse suspects he is having auditory hallucinations. Which of the following questions should the nurse ask first? 1. Are you seeing someone other than me? 2. What are you hearing right now? 3. What is going on with you right now? 4. Do you want to go to the recreation room? The correct answer is 2. Before intervening with the client experiencing hallucinations, the nurse must validate what the client is experiencing. Asking the client what he hears right now accomplishes this. Asking about seeing someone near the client would be appropriate to validate visual hallucinations. Asking the client about what is going on may be helpful. However, the question is too general to validate that the client is experiencing auditory hallucinations. Asking the client if he wants to go to the recreation room might be appropriate after the nurse has validated what the client is experiencing. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative, 2. Needing to be repeated, 3. Positive, 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm raised area or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. When preparing the teaching plan for a client who is to start clozapine, which of the following is crucial to include? 1. Description of akathisia and drug-induced Parkinsonism. 2. Measures to relieve episodes of diarrhea. 3. The importance of reporting insomnia. 4. An emphasis on the need for weekly blood tests. The correct answer is 4. Clozapine is associated with agranulocytosis. Therefore, the nurse must instruct the client about the need for weekly blood tests to monitor for this adverse effect. Akathisia and drug-induced Parkinsonism are associated with high-potency antipsychotics. These effects are not common with this atypical antipsychotic agent. Constipation and sedation may occur with this drug. Which of the following techniques for administering the Mantoux test is correct? 1. Hold the needle and syringe almost parallel to the client's skin. 2. Pinch the skin when inserting the needle. 3. Aspirate before injecting the medication. 4. Massage the site after injecting the medication. The correct answer is 1. The Mantoux test is administered via intradermal injection. The appropriate technique for an intradermal injection includes holding the needle and syringe almost parallel to the client's skin, keeping the skin slightly taut when the needle is inserted, and inserting the needle with the bevel side up. There is no need to aspirate, a technique that assesses for incorrect placement in a blood vessel when giving an intradermal injection. The injection site is not massaged. A client reports that men in blue clothes keep looking in her window and talking about her. Which of the following responses by the nurse is most appropriate? 1. Those men are groundskeepers. They're talking about their work, not you. 2. Don't take things so personally. Not everyone who is talking about you. 3. Let's not pay attention to men. Let's play cards instead. 4. I'll close the drapes so you can't see the men. The correct answer is 1. The nurse needs to present the reality of the situation. By explaining that the men are groundskeepers and probably talking about work, the nurse is reinforcing reality to counter the client's illusion. Additionally, this response voices doubt in the client's paranoid interpretation. Telling the client not to take things personally is flippant and judgmental. Telling the client to not pay attention to the men fails to address the client's misinterpretations and misperceptions. Closing the drapes so that the client doesn't see the men ignores the client's misperceptions and misinterpretation. A client had a Mantoux test result of an 8 millimeters in duration. The test is considered positive when the client 1. Lives in a long-term care facility. 2. Has no known risk factors. 3. Is immunocompromised. 4. Works as a healthcare provider in a hospital. The correct answer is 3. An induration of more than 5 to 15 millimeters to 10 Mantoux units is considered a positive result, indicating TB infection. An induration of greater than 5 millimeters is found in HIV-positive individuals, those with recent contacts with persons with TB, persons with nodular or fibrotic changes on chest X-ray consistent with old healed TB, or clients with organ transplants or immunosuppressed. An induration of greater than 10 millimeters is positive, and the client may be a recent arrival from high-prevalent countries, resident or an employee of high-risk congregate settings, or mycobacteriology lab personnel. Persons with clinical conditions that place them at high risk, a child less than 4 years of age, or a child or adolescents exposed to adults in high-risk categories. A pregnant client in her third trimester is started on chlorpromazine 25 milligrams 4 times daily. Which of the following instructions is most important for the nurse to include in the client's teaching plan? 1. Don't drive because there's a possibility of seizures occurring. 2. Avoid going out in the sun without a sunscreen with sun protection factor of 25. 3. Stop the medication immediately if constipation occurs. 4. Tell your doctor if you experience an increase in blood pressure. The correct answer is 2. Chlorpromazine is a low-potency antipsychotic that is likely to cause sun-sensitive skin. Therefore, the client needs instructions about using sunscreen with sun protection factor 25 or higher. Typically, chlorpromazine is not associated with an increased risk of seizures. Although constipation is a common adverse effect of this drug, it can be managed with diet, fluids, and exercise. The drug does not need to be discontinued. Chlorpromazine is associated with postural hypotension, not hypertension. Additionally, if postural hypotension occurs, safety measures, such as changing position slowly and dangling the feet before rising, not stopping the drug, are instituted. Which of the following family members exposed to tuberculosis would be at highest risk for contracting the disease? 1. 45-year-old mother. 2. 17-year-old daughter. 3. 8-year-old son. 4. 76-year-old grandmother. The correct answer is 4. Elderly persons are believed to be at higher risk for contracting tuberculosis because of decreased immunocompetence. Other high-risk populations in the United States and Canada include the urban poor, clients with acquired immunodeficiency syndrome, and minority groups. A client diagnosed with paranoid schizophrenia is still withdrawn, unkempt, and unmotivated to get out of bed. A mental health aide asks the nurse why the client is this way after being on fluphenazine 10 milligrams for 7 days. The nurse should tell the health aide, 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. 2. The client will be less withdrawn and unmotivated when the fluphenazine takes effect. 3. The client's fluphenazine dose probably needs to be increased again. 4. Lack of motivation is a common side effect of fluphenazine. The correct answer is 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. Positive symptoms are those that are added to a person's experience, such as hallucinations, delusions, and disorganized thinking. The client's symptoms reflect the negative symptoms. Negative symptoms are things taken away from the person's experience, such as lack of emotional expression, lack of motivation or drive, and social withdrawal. Fluphenazine generally is effective in 3 to 7 days for the positive symptoms. An increased dose or longer time on fluphenazine will not help the negative symptoms of being withdrawn and unmotivated. The nurse is teaching a client who has been diagnosed with tuberculosis how to avoid spreading the disease to family members. Which statement indicate that the client has understood the nurse's instructions? Select all that apply. 1. I will need to dispose of my old clothing when I return home. 2. I should always cover my mouth and nose when sneezing. 3. It is important that I isolate myself from family when possible. 4. I should use paper tissues to cough in and dispose of them promptly. 5. I can use regular plates and utensils whenever I eat. The correct answers are 2, 4, 5. When teaching the client how to avoid the transmission of tubercle bacilli, it is important for the client to understand that the organism is transmitted by droplet infection. Therefore, covering the mouth and nose when sneezing, using paper tissues to cough in with prompt disposal, and using regular plates and utensils indicate that the client has understood the nurse's instructions about preventing the spread of airborne droplets. It is not essential to discard clothing, nor does the client need to be isolated from family members. When developing the plan of care for a client who is staying in his room because he perceives that staff want to harm him, which of the following outcomes of care planning is most realistic? 1. Within 2 days, the client will complete activities of daily living. 2. Within 3 days, the client will participate in recreation with other clients. 3. Within 4 days, the client will demonstrate an absence of verbal aggression. 4. Within 5 days, the The client will seek out staff to talk about feelings. The correct answer is 4. The client is exhibiting suspiciousness of and a lack of trust in the staff, not aggression. Seeking out staff indicates the development of trust and decreased suspiciousness. Although completing activities of daily living and participating in recreation with other clients are important, the major problem presented is related to the client's isolation and perception of being harmed, not, for example, showering, hygiene, or other clients. A client has a positive reaction to the Mantoux test. The nurse interprets this reaction to mean that the client has 1. Active tuberculosis. 2. Had contact with Mycobacterium tuberculosis. 3. Developed resistance to tubercle bacilli. 4. Developed passive immunity to tuberculosis. The correct answer is 2. A positive Mantoux skin test indicates that the client has been exposed to tubercle bacilli. Exposure does not necessarily mean that active disease exists. A positive Mantoux test does not mean that the client has developed resistance. Unless involved in treatment, the client may still develop active disease at any time. Immunity to tuberculosis is not possible.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.